Hi guys, my name is Raquel Anyag and I'm doing my report on prostate cancer. All right, so etiology, there's different types of causations that happen with prostate cancer, and one of them is the changes in DNA, and that could be from mutations in the DNA. So obviously changes causes abnormal cells to grow, or it could be hereditary, and 10% of the diagnosis of prostate cancer happen uh, in the US, and that's passing it from person to person. Also, another causation is hormones. The prostate gland produces a type of hormone called androgens, and if there's a high amount of androgens that are produced in the prostate, that could be the cause of prostate cancer. And then insulin-based hormone called IGF-1 can also cause prostate cancer to happen. Patients that are exposed to radiation or cancer-causing chemicals also can get prostate cancer. And one of those that I found interesting is Agent Orange. Agent Orange is a herbicide that was used in the Vietnam War, and that was to destroy crops in Vietnam to find enemies. And little did we know that Agent Orange was that it also caused an abnormality in cells, and that caused prostate cancer in some of our soldiers. Also, another causation is diet. If a patient has a higher intake of dairy, they are also prone to prostate cancer. And then also obesity, if you are diagnosed with prostate cancer, they have a higher risk of getting the higher grade prostate cancer type. And that means that type of cancer will grow rapidly in the body and it's harder to treat. Okay, so demographics. Prostate cancer is most common in men, and that's because women don't have a prostate. Prostate cancer is the second most common cancer for men in the United States. And according to the CDC, 1 out of 9 men are diagnosed with prostate cancer. And then 1 out of 41 men actually die from this type of cancer. The men that are at higher risk are older men, just because the prostate, as a man ages, the prostate will grow and enlarge. And also African American men are at risk due to hereditary issues or diet issues. I got stats from the CDC as well. 191,000 to 930 cases were diagnosed in the year 2020, and 33,330 actually died from prostate cancer. On this map here, you can see where prostate cancer is more common, and for some reason it's in the east side rather than the west side, which I find interesting. Okay, so anatomy. So here is the prostate gland. It is inferior to the bladder, and it is anterior to the rectum. Okay, the types of tissues that the prostate gland has is exocrine glandular tissue, which is responsible for semen secretion, and also a fibromuscular tissue. It has smooth muscle tissue that helps contract semen out, so it helps with ejaculation. And also dense irregular connective tissue, which helps strengthen the prostate gland, especially during ejaculation. So physiology and symptoms. Physiology of the prostate gland, there's 3 functions: secretion, ejaculation, and urination. In secretion, the prostate gland is responsible for a large portion of the semen volume. It's a milky white mixture. It has sugars, enzymes, and alkaline chemicals in it. The sugars, which is fructose and glucose, is nutrition for sperm when passing in the female body. And then the alkaline chemicals help neutralize acidic vaginal secretions, and it helps the sperm survive to fertilize the ova. Ejaculation, like I said, the smooth muscle helps ejaculate the semen out, and it starts with the ductus deferens and then the urethra and out of the body. In normal functions of the prostate gland, it passes through with no complications. But if the patient has prostate cancer, one of the symptoms is urine issues. And in this image that I have, prostate cancer, if the patient has it, it blocks their urethra, and the patient has problems urinating, and sometimes they could even find blood in the urine. And with sexual issues, since it deals with semen ejaculation, some patients can also be diagnosed with erectile dysfunction, so they have a hard time staying erect during sexual intercourse. And patients also find pain in the hips, back, or chest. And as the cancer spreads, the more pain they will have. They can also find weakness or numbness in the lower part of the body, because if the cancer spreads and is compressed against the spinal cord, that deals with the nerves, and the nerves they get exposed and it causes numbness. Okay, to diagnose prostate cancer, there are several different tests. One of them is digital rectal exam, and that deals with a physician wearing a glove that's lubricated and goes through the anus to feel the prostate. And I have an image right here. You can see that this is the prostate, and he's trying to feel for any abnormalities, such as like abnormal bumps or maybe an enlargement of the prostate. And if that is found, then they will do a PSA blood test. And that the PSA stands for prostate-specific antigen, and that is produced by the prostate and other cancers and cancer cells as well. And they measure how much prostate-specific antigens are in the blood. And if it's higher than 4 nanograms to milliliters in the blood, then they might suspect prostate cancer. And if it's more than 10 nanograms per milliliter, that's a 50% chance that they have prostate cancer. So with that being said, if it's higher than that, then they will also initiate a prostate biopsy. And the most common one is a core needle biopsy. And that deals with, it's only like 10 minutes for the biopsy. So they poke a needle in, and then after that, they take a small sample of the prostate, they send it to the lab, and they find abnormal cells to see if it's actually prostate cancer. Okay, so treatment, depending on how much abnormal cells they find in your prostate, that means it depends on the treatment. So they score it from a score called the Gleason score, and it's 1 through 10, 1 being the lowest, 10 being the highest, and probably the most untreatable. So some patients that are older, maybe like 60 to 70, sometimes they won't even do anything and will just watch it and observe, and they will do several PSA tests. But if they have a chance to beat the prostate cancer, they can go through surgery, which is the most common is a radical prostatectomy. And that's when they remove the prostate gland entirely. And they also remove lymph nodes that surround the prostate. And one of the symptoms is erectile dysfunction and also a loss of sexual appetite. Another treatment that they can do is a radiation treatment. Symptoms for that is urinary urgency, diarrhea, rectal discomfort, and bleeding, fatigue. And radiation therapy deals with putting a high energy rays towards the cancer cells to destroy them. One of the most common ones is the external beam radiation. Okay, and then systemic treatments, and that includes chemotherapy, which is drugs that they give to fight the cancer, immunotherapy, which is a therapy that boosts your immune systems for the body to naturally destroy the cancer cells, or testosterone suppression. And symptoms for that is weight gain, loss of muscle mass, erectile dysfunction, memory loss, loss of sexual desire, gynecomastia, which is the growth of breast tissue, or osteoporosis, which is bone loss. So if the patient survives from prostate cancer, they don't just go and up and leave and say, okay, you're fine. Cancer can spread throughout the body, and that entails follow-up appointments. And that means more routine tests, DREs, and PSA blood tests. And that is about it. And these are my references. Thank you.